Good evening, everyone. Tonight is July 22nd. This is our Board of Health meeting. Everything's going to be recorded and live and available via Foxboro cable access and later on YouTube. So tonight we're going to start with a presentation from our summer intern. Justin, if you would like to start.
Hi. Can I press?
Yes.
Okay. Hi, my name is Justin. Tonight I'll be doing a presentation on opioid settlement funds, and I'm looking at what the town of Foxboro can expect from these funds and going over primarily the recent community impact survey. So for the agenda for the presentation, first I'll give some statistics to kind of characterize the current opioid burden in Foxboro. I'll do a quick introduction into what opioid settlement funds exactly are, and then for the most of my
Sorry.
time,
Don't press the button, Justin.
sorry.
Yeah, sorry. You don't have to press the button.
All right, sorry.
You can, and if you just speak up a little bit for the people in the crowd
Yeah.
as well.
So should we start?
I think you sound better now without pressing the
Yeah.
button.
All right. Hi, my name is Justin. Tonight, I'll do a presentation on opioid settlement funds in Foxboro, kind of painting what the town can expect from these funds and also going over the recent community input survey results. So for the agenda for the meeting, first, I'll give some statistics to characterize the current burden in Foxboro, and then I'll go over a quick introduction into what opioid settlement funds exactly are. Then for most of my time, I'll go over the community input survey, and then at the end, we'll leave some time for some questions and comments. So for the burden in Foxboro, I took some data points from a couple different state data sets, dashboards, as well as some internal town data to kind of give some major events related to the opioid epidemic. So from the period of July 2022 to June 2023, there was one opioid-related death. This asked 26 confirmed opioid-related overdose deaths from the period of 2016 to 2022. And then all the following data is from the previous year. There were 15 opioid-related ER visits, 27 opioid-related EMS incidents, 13 patients administered with Narcan by paramedics, 4 patients administered naloxone by paramedics, and EMS reported to 36 opioid overdoses in the past year, with 2 patients being pronounced dead on the scene. Oh.
You can still look towards it. I'm just going to.
Sorry.
And the lights, maybe, it might make it easier to see.
And one thing about the point about 27 opioid-related EMS incidents, the crude rate for that is 145 per 100,000 residents, which is actually 6.4% greater than the overall county rate. And so moving on to the available programs in the area, these are limited. There's only one provider providing community-based treatment services and 0 providers offering community wraparound or legal involved treatment services, which is very imbalanced considering there are 33 residents receiving community-based treatment services, 6 residents receiving wraparound treatment services, and 27 residents receiving legal involved treatment services.
Just as a definition, can you explain what a wraparound service is?
So from my understanding, a wraparound service is kind of a multi-step kind of recovery process.
Okay.
Yeah.
Thank you.
So kind of giving a general overview of what opioid settlement funds are. Massachusetts has joined states across the country in nationwide lawsuits against opioid manufacturers, distributors, and pharmacies who have been accountable in this epidemic by kind of making these drugs very accessible. And so in 2021, Massachusetts received its first financial opioid settlement with additional litigation still ongoing. And so the ways these funds are distributed is that 60% goes to the state's opioid recovery and remediation fund, which is kind of the state's, that funds states, the overall state's programming towards abatement activities, and then 40% of funds are allocated to municipalities. These first started being distributed in 2022, and these help strengthen abatement activities at the local level. And so expected funding, as I mentioned earlier, litigation is still ongoing, so these are kind of based off kind of the max possible funds from the lawsuits. And as you can see here, there's quite not only a variance in the amount of money per source, but also in the amount of time. For example, the distributors, those are referring to a few pharmaceutical companies. They're responsible for by far the most amount of money, $438 and $21 expected, and they will be also liable for the longest amount of time to pay until 2038. And so most of these payments are done in yearly increments. The distributor payments range from about $18,000 to $29,000 a year. For the rest of the sources, with a few exceptions, they range from about $6,000 to $12,000 a year. Some of those exceptions are that Walmart paid their funds as a lump sum earlier this year in March. Johnson & Johnson started paying $75,673 as a lump sum in 2022, with yearly payments afterwards ranging from $3,000 to $18,000. And so in total, Foxborough received an estimated $975,672 by 2038. And so on average, that comes out to $60,979 per year. So the main project I've been working on with the health department is looking at the community input survey and kind of visualizing that data for the community to look at. So some background information from April to June of this year. The health department, they put out a survey to gather community thoughts on the best use of opioid settlement funds to benefit the town of Foxborough, specifically seeing which key abatement strategy categories the residents would most support as defined by the state. These are opioid use disorder treatment, support people in treatment and recovery, connections to care, harm reduction, address the needs of criminal justice involved persons, support pregnant or parenting women and their families, including babies with neonatal abstinence syndrome, and then prevent misuse of opioids and implement prevention education. And so for some descriptive statistics of the survey demographics, on the right, there was a sample size of 88. 89% of participants identified as white/Caucasian, which is in line with the demographics of the town. 75% identified as female, and then for age, there was a little more variance within that group. The largest majority was, with 48%, was in the 50 to 69 age range. And to go over, so next I'll kind of go over each question on the survey. There's a lot, so I'll kind of go over them quickly, and then at the end, if there's any clarification, I can go over that for that. First, for the first question asked about the community impact of the opioid epidemic on people in the community, this kind of adds upon to the earlier statistics I gave about the burden. And so this question, it allowed for participants to select multiple responses. So I thought the best way to kind of visualize this data was just to show the response count, or show the count per response. So just reading in order from greatest to least, it was, I have not personally been impacted by the opioid addiction, with 33, followed by I work with individuals and or families impacted by opioid addiction, tied with 22 responses, with I have a loved one in recovery from substance use disorder. Next is I have lost a family member or members to opioid addiction/overdose. Next is other. There wasn't any kind of specific area to kind of explain what other means for people, so that kind of information is as it is. And then next is I have a family member who currently have opioid use disorder. And then lastly, I'm in recovery from opioid use disorder, with 3 responses. So I think from this data, we can see that there's many people in Foxborough who have been impacted by the opioid epidemic in some way or another, even though maybe this data didn't get too many people who kind of are directly facing addiction themselves. And the next question went over programming, asking residents and community members which of those 7 key abatement categories I mentioned earlier they would most support. So again, going kind of in order from greatest to least, most people supported support people in treatment and recovery, followed by prevent misuse of opioids and implement prevention education, opioid use disorder treatment, harm reduction tied with connections to care. Next, support pregnant or parenting women and their families. And then lastly, address the needs of criminal justice involved persons. And one thing I want to note with this question is that this did ask people to select one choice. However, there was many responses that selected multiple, which I think is still valid and important because the purpose of the survey is for community input. However, I just did, out of interest, I did do a secondary analysis of the data, kind of extracting people who had more than one response. And so the second graph on the right with only 60 responses, we can see actually the ordering is mostly the same. The main change is that harm reduction is swapped to 3rd instead of opioid use disorder treatment. And then near the bottom, support pregnant or parenting women and their families, and connections to care, those are also swapped.
But the prevent misuse of opioids changed a lot in the two.
It's still in the second most.
So it's kind of a call out. So this second category here, the second on the red slide,
Yeah.
is it's a call it of those who answered
Only-
the second time.
They only answered, so the question asked people to pick their most important, and this is that. So there's 60 for that, and then 88 on the left, 88 people, and those selected multiple responses.
And just to clarify that, this was made as an electronic survey, and we did end up handing out a lot of paper forms. And for that reason, people checked multiple. So then we still had to find a way to, take that data in and make it valid, and that's what Justin's talking about.
Not quite a ranked choice, but
And so kind of the next question moving on, this kind of is similar to the kind of giving a few more specific programs / items that the town residents may support. These kind of fall under the similar, these all fall under the abatement strategies categories. And just for time, I kind of go over them quickly. The top three, increase support and promotion of treatment of people with opioid use disorder, support Foxborough residents currently in treatment or recovery, and evidence-based substance use prevention education at Foxborough schools. Those all kind of would fall under the same top three most supported abatement activity funds on the left side, at least, with all the participants. And so also I wanted to kind of go over some stakeholder input from kind of some groups that are kind of most directly involved with the opioid epidemic, whether through kind of policy actions or being kind of exposed to the front line. So for school officials, there were 3 respondents, and for their top activities, they selected prevent misuse of opioids and implement prevention education, support people in treatment and recovery, connections to care, support pregnant or parenting women and their families. And some specific comments that they left were utilize funding to supplement the cost of interface to support mental health, support students in need of substance abuse support, and partner with outside agencies. And they cited the Gosnell Behavioral Health Services partnership currently as something to expand upon, as an example of something that they were talking about. And also in general, they said the opioid epidemic needs more trauma-informed practices and awareness. For government officials, there was 1 respondent. They selected connections to care as their most important activity, and their main comment was that they felt there is a crucial lack of available programs in the town. And then there was 1 respondent who identified as both as EMS and law enforcement, and they selected prevent misuse of opioids and implement prevention education as their most important activity. And so there's also a few dichotomous yes or no questions in the survey, asking if residents would support a few different activities in the town. I'll read them off. The yellow bar graph asked if residents would support more education on opioids in schools. In the red, it says, would you support increasing the amount of resources available to first responders? The green asks, would you support the town to support local opioid treatment and recovery programs? And the blues asks if they would support Narcan and training distribution. And there's a few missing data points from people who didn't answer these questions. However, as you can see, they're all kind of overwhelmingly saying yes. And again, there's kind of no place for people to say why they may have answered no. However, later on, I'll go into some comments people left, and I think from there we can kind of indirectly extrapolate why some people may have said no. And there's also one last dichotomous question asking, should funds be used for single or multiple programs? And this was also kind of overwhelmingly in one direction, it being multiple programs with 71 responses versus 12 for a single. But there is a kind of a higher variance here, and I think that can may be explained by the survey didn't kind of provide information on what the funds actually are. And so I think if they provided it, maybe the data would be changed. Because there was one comment, someone said they didn't know how to answer the question because it would depend on the funds. And so, as I mentioned earlier, there's a couple open answer questions along with an open comment box. These questions ask things like kind of ideas about specific programs that people have, challenge they see for people facing addiction in Foxborough, and also just kind of gaps they see in services in the town. And so I thought the best way to look at this data was to kind of categorize them based on similar topics in a qualitative code book to show some emerging themes, which I've visualized with this word cloud graphic. For clarification, the larger text means more responses, and for scale, care access that had 17 responses, and then the smaller text, there's a few that are the same size. I think training and decriminalization, though, those have 3 responses. And so you can see here there's a lot of different topics that were covered by residents that were important, such as training of kind of stakeholders in the area, awareness of opioid use, quality of services, education. And so I thought the best way to kind of look at this would kind of show some quotes from people in the town, what they wrote. And so I've selected the top 3 themes that I've identified, kind of in order is going to care, access, stigma, and education. So I'll just read a few of these to kind of give an idea what people are saying. For care access, the first quote, finding the correct treatment is difficult for people in active addiction who want to recover to get through the paperwork of treatment. Many people need support doing this. Sometimes even finding a PCP is a challenge. And this kind of relates back to my beginning where I mentioned there's only one provider of substance abuse recovery in the town. And for stigma, this first quote I'll read, I also think there is the misconception that there isn't an issue in the community, so resources for this issue are often swept under the rug so it doesn't ruin the picture-perfect town image. And I put this quote because there's a few people who wrote specifically about stigma in Foxborough and how, kind of based off their perceived culture of the town or kind of the size of the town, they think that opioid epidemic and substance abuse in general is kind of ignored or people don't believe it exists. And lastly, for education, I'll read the first quote. I think like across the rest of the state, there could be more done for education and to get ahead of those who are addicted going homeless as well. And also the last quote I think is also important. More education for people prone to addiction being prescribed meds, because when we talk about the opioid epidemic, of course, there's so many facets to it. And so I think this person it was interesting how they brought up prescription meds as one area to consider when going for programming decisions. And again, this is kind of a general overview of a lot more responses people wrote. Some of these kind of have conflicting opinions. I'll just pick out a few for time. Kind of in the left side, in the kind of the bright blue, we have some discussion about police funding. There's one quote that says, I believe that there should be resources outside of law enforcement that should lead this initiative, as I think that treating those with addiction issues should not automatically be treated as criminals. Take away the dependence first, and you reduce the criminal activity as the byproduct. And that's kind of in contrast, someone saying increase police funding, lobby for increased penalties for distribution. And I think some of these ideas can kind of maybe explain why some people may have said no earlier to increasing resource first responders. Below that, in the lighter blue, some discussion about kind of reintegration for people struggling with substance abuse. In the green, there's also a quote saying the treatments need to be updated and improved for effectiveness. And I think this kind of shows how maybe explain why some people may have said no to supporting local programs, because it's not necessarily that they don't support them, it's just that there's an issue with the quality of them, and they think that if we're spending money, they should be effective first most. And then the last one I'll go over is kind of in the top right, in the kind of the dark gray. There's one quote that says, this kind of deals with youth in schools. One of them says, we really should also focus on the youth and the misunderstanding that they have for the use of these drugs. In contrast, there's one saying, showing high school students a movie of someone in active addiction shooting up and then overdosing and dying is not education, especially when those students may have a parent or loved one that has an active addiction at home. And I don't think the top quote necessarily says that focusing on youth isn't important, but it's saying that, again, similar to the quote in green, it's about the quality of the programming. And so just to kind of bring up some other communities and what they're doing with their opioid settlement funds, in Rentham in 2023, they awarded $42,000 to various groups that applied for funding. This includes Safe Coalition, their organization that deals with kind of prevention and recovery. Gillies House, they're a sober house. They were also recommended in our survey. Healthy KP Substance Use Prevention Coalition, Trinity Episcopal Church, and Rentham and KP School Wellness Program. And Plymouth, as I imagine most towns are doing, kind of did a similar program. However, one thing they also did, they created the Plymouth Addiction Response and Improvement Strategies Effort Group, also known as Plymouth Arise, and this kind of leads all of the opioid abatement settlement spending and kind of the overall response. And so just recently in 2024, they began distributing grants up to $50,000 to 5 agencies, including Bay State Community Services, Inc., Brockton Area Multi-Services, Inc., High Point Treatment Center, Plymouth Public Schools, and To the Moon and Back, which is an organization that deals with, supports children exposed to opioids before birth. And so just kind of a final thing to discuss is that there's a lot of community collaboration going on. In Norfolk County specifically, there's a few towns and there's a few community agencies that are around that kind of deal with this, that kind of been planning a lot of opioid abatement funds. These include Dedham Drug Free Community, Braintree Community Partnership, and Canton CAASA. And so based on the results of the survey, we see the following categories as priority areas to focus on. These include, first, support people in recovery. Second, prevent misuse of opioids and implement prevention education. And 3, both harm reduction and opioid use disorder treatment. And so I'd like to open up any questions and comments from the board or the public.
Thank you.
Thank you.
One, I want to say, Justin, thank you very much. This is a lot of information,
Yeah.
and it was a great presentation. One question that I have is when you talk about care services in Foxborough, did you also look at care services in surrounding communities that Foxborough residents can use?
So I took the data directly from the state, and so it doesn't not necessarily indicate where those services are what town those services are being utilized. I do have kind of a list, kind of just researching what areas are available in the area. I don't have that information on me right now, but there are kind of more in the area than Foxborough.
Okay, thank you.
I had a more of like a data comparison question. The majority of the data that you pulled from the state was based on 2023 and the 2022 reports. In your research, and it's okay if you say no, were you able to go back maybe a few years prior to 2022, 2023 to see how these last couple years are comparing back to previous years? And if there's been a change or if anything shifted or gotten worse?
I do believe, I don't have it on me, so I'm not 100%
That's
sure,
fine.
but I believe it is improving overall.
Okay, thank you.
In terms of like death rates, it's going down more.
Okay.
Yeah.
Did you have any questions? 'Cause I can.
I just noticed that the presentation I had in front of me didn't quite match up the numbers with the one that was presented, but very slight differences, no big deal. I think just overall that we got 49, what is it, 96 responses?
80.
96 total or something like
88.
80 responses. Kind of a bummer, but it's still it's still a sample, right? It's
Yeah.
it's a decent subsample for those who vote in this town. So it's important to know. And yeah, I think your analysis of why people would say no, they don't want to fund it, was fair. Like, I think saying that they just didn't know exactly how to answer it because of their own different conceptions. And we just want to make sure we don't assume that everyone was just like, man, no, for everything, that we don't want to be part of anything. So I thought it was good. Good job.
Thank you.
I appreciate the word cloud, and I do appreciate that. Sometimes that really does bring it home, like to see something, the word stigma being so highlighted there. I think that's important for many people to, get past that and move forward. So that was a
Thank
good
you.
idea.
That was Matt's idea, the word cloud.
Damn it, take credit, man. He would have let you. Thank you, Justin.
One of the things that I noticed, which was really good, is that you showed us how some of the other communities use their money.
Yep.
And we do have some really good services in this area. So it just seems to me that some of our money at least, if we're recommending, should support some of our services that are in our area already.
Yeah. It's interesting because the funds were supposed to use it for prevention, harm reduction, treatment, and recovery. And part of why we did this was to make sure that we knew what the town wanted.
Mm-hmm.
And in your programming, or in our programming survey question that says what was most supported by the abatement activity funds, there was an overwhelming majority, if you divided them up into, if you could, 2 categories, about 107 responses were treatment, support, and care. So the folks who already have started using or are past using and trying to recover and get their lives back on track. And then another 63 focused towards harm reduction and prevention. I mean, at least for us in the town, it kind of pushes us towards treatment, support, and care a little bit more than harm and prevention. It'll be interesting to see how we, in the rest of the town, how we end up using that. But I don't know. It's good to, at least for us, it's good to have that data because we didn't, we're trying to figure out what's best, what do people want, and what are they focusing on.
And the other thing about the education is that there are some good programs out there that are vetted. And so we shouldn't just say, oh, this sounds good, and, do that program and, be sensitive. That statement really resonated with me, that we do have to be careful of the type of education that we do in the schools, because we don't really know where, where they are, the students are and what they're.
Yeah,
what
make
they're
sure
like.
none of the programs are sponsored by a pharmacy.
Exactly.
Yeah. Do we have any questions from the audience?
Or comments?
If you would state your name, address, come up and sit by a mic. Name, address, and affiliation if you have another one.
I'm David Gilmeister. I live in Rentham. I'm with Gilly's house, which you saw up there. My question is, going forward, I'm assuming you're going to put out an application online or something that people will apply for money. And and I was actually on the committee that developed Rentham's process. The one thing that I always missed in it is an explanation of why you deserve the money. Mm-hmm. So, and none of the applications I've seen out there so far, and there's only been 3, say anything about that. It's basically how much do you want and where are you going to spend it, which is not the same thing as why do you deserve it. So I would, recommend when you do make up an application that that's a piece in there, because I think that's a really valid reason for what you're looking for to do with the money.
I do have a question for you. When Rentham gave you money, was it specifically for Rentham residents?
No, the Safe Coalition in Franklin got money. Otherwise, everything else was Rentham. The school got some money. First responders got a little bit of money, but the majority of it went to the school, the Safe Coalition for Franklin, and us.
Okay. Thank you.
Thank you.
Okay. I'm Barbara Gilmeister. You have to add to what your husband said, So we do service. We've had people from over 70 communities at Gilly's house. So we're honestly the only house around. We're the only nonprofit, MASH certified, sober recovery house that has staffing by men in recovery, long-term recovery, 24 hours a day. But we've had people from over 70 communities in Massachusetts. People can come from anywhere. I mean, today we just got a call from somebody in Arizona. And we've had a gentleman from Washington State. So there's no cutoff or anything. So we're open to whoever, calls us, so.
I just want to say that I'm familiar with Gilly's house, and you do absolutely wonderful work, and thank you very much.
Thank you.
Yeah,
Thank
agreed.
you. Thank you.
Just a quick question. Something, since Gilly's House focuses primarily on men,
Yeah.
recovery for men, have you always kind of wanted to see a partner recovery house for women in the area? Is that something you?
There's definitely a need
Yeah.
for more women's sober housing. There's really only one that we're not familiar with everybody, to be fair, but when people call and they want a recommendation, we do recommend a house in Attleboro, not for women, but it's a 13-bed house. It fills up really quickly, but it's a really well-run house.
Just thinking.
And what about for youth?
So we have 21 beds, and it fluctuates all the time, 18, 19, 20 beds. You never know. We get calls all the time.
No, I meant for youth, for younger.
Oh, so you have to be at least 18 to come to Gillies. Younger programs, I think, are very specialized. Our private pay. We had a gentleman who went to one, and I can't think of the name of it. We started 18. We had that gentleman graduated high school at Gillies House. So, and he's doing really well now.
Thank you for what you do.
Yeah, thank you.
Really appreciate it.
Thank you for your time.
Thank you.
Thank you for your presentation. It was a lot of work.
Yeah, come up.
Hi, I'm Jennifer Quinn. I live in Albro Street in Foxborough. I'm also on the advisory board of Turning Point Peer Recovery Center in Walpole, Mass. On Common Street. My question is this was a great presentation. I did take the survey as a resident of Foxborough. However, I found it very difficult to find, to be perfectly honest with you, on the website. And I was just wondering what other avenues you took to get more respondents other than just relying on the website, because I did find it really hard as a resident.
Thank you for that, and that is a problem, always reaching people. But as soon as you came here into Town Hall, we did have a flyer that said, please go to the website with the QR code, as well as having paper copies. So anyone that visited Town Hall hopefully would have seen it walking in the door. Also, we went to Founders Day, the town's biggest event, and we had Founders Day, we had the surveys available, and that was by far our biggest turnout. And then, we asked others in other departments like the library and the senior center to post information about it too and have it available. So we tried to, and then I gave it to some of the leaders in town to try to disseminate the information. But that was what we did to get it out there. But I do realize things do get buried in the website.
We also had the Narcan training,
Yes, that's true.
and that was a in-person training that was held at Public Safety, and people had the opportunity to, I think that was well attended. There were about 30, 40 people there, and they did it by hand or if we had the QR code. So that was an option, but it is really good feedback. If we're not, 96 people out of 18,000.
Yeah,
is
that's why I
not
said
the
a small
greatest.
sample size.
Yeah.
One thing you could do is if this budget is, and if there's will, not everyone always does this, but as we know, it's voting season, people vote by mail. There is perhaps an opportunity to have the surveys go out to all residents with a return envelope. That's always the cost. So I don't know, that's something to think about. It's an old-fashioned paper, but I actually found it, the announcement on the website, if you went to the Board of Health, the main town website, I agree with you.
Yeah.
But if you clicked on Board of Health, it was the main page for quite some time.
Yes, I did ask the town manager's office to post it on the main menu, and it was there for a little while, but unfortunately, new events come up.
Yeah.
And the same thing, at one point, it did come out on Facebook or Instagram as well. But again, once it comes out, we do it a couple times, and if people respond, they respond, and if not, yeah.
I also wonder too if maybe the length of it was a little off-putting for some people to respond.
Too long or too short?
Too long.
Too long. Okay.
Yeah, I think maybe because when I filled it, I know I was like, oh, I have another page to go, and then I got to the end. I was like, now you want me to do open response, and so I don't know if that was in a paper form, if getting a packet was too off-putting, and maybe there's a way to condense it down to just getting just the highlights of of what you're trying to look at versus getting all the nitty gritty and just trying to get all the data at one point.
Yeah.
You know?
I think the hard part for that is, as a town, we're going to receive over the course of the next few years, we're going to receive $1 million, and you really want to know that you're capturing the audience, and you're really asking those questions, and we don't want to miss anything. But it's also possible that we can, we're going to be getting the money for the next, until 38, right?
Theoretically.
Yeah, so, whatever we implement now, we can always follow up in the next few years. This data is always going to be reported back to the state. And we can, if the next few years we don't see progress, we switch it up, we ask a new survey. And we'll definitely keep in mind keeping it a little bit more shorter and easier to digest. I did have a question for you.
Yeah.
Where would you recommend we put the survey? If you had the choice, because we know what we did, but where are our gaps in
Well, I
communication?
think, we're very heavy into like social media. I know there's an Instagram page. I don't know how well, if the Board of Health has like a Facebook page or if you could put it on a town website. I don't, or a town Facebook page. I do know a lot of things are posted, on the discussion pages. I don't know all of the rules and regulations, but I do know that we're very tuned into being online. And even if it was on the website, maybe just making it a little easier to find, because it did take me quite a few clicks. And like I said, I don't know all the ins and outs of how everything works. But I also think too, if it's shorter, just, take the survey that you put out and just, if we're gonna be using this for till 2038, getting money, we can just get the big picture right now. What is the big ideas? And then from there, you can then focus on, okay, education was one, harm reduction.
Yep.
And then that could be something that's a separate survey.
I think this was a really great starting point, and a lot of the good points he brought up, Justin brought up in the presentation. And also, because this was our first stab at it, right?
Yeah.
That was a terrible metaphor, but anyways, first attempt at it. And we had to kind of cover all these things to get a. Part of it is because we have the money now. We weren't one of the towns that just rushed to it. We wanted to get it right and send it out to the community. But yeah, I guess we can do a second round. But we kind of maybe we have to cover all these things because we have to know what are the key points as a jumping off point. But I 100%.
Well, I would just say a lot of folks haven't started spending this money yet,
Right.
and
We
were one of the beginning ones to actually put out this survey.
Yeah.
There had been others.
They didn't do a survey. They just
but
was like, we're going to put it in
They
education.
some people just spent it. But we wanted to get that out. And this survey was developed by another community, and it was recommended. I worked with an advisor at Boston Medical to do it. So this is what they recommended in order to get the data that we needed from the community. But no, I totally appreciate it, and it's something that we can maybe shorten now that we have the, the feedback, the original feedback. We can shorten, we can keep it up. So if the public wants to just give us, some more information, if things change, we can leave it up there so people can submit that in an easier way.
And Jen, now the town has somebody to help us with, hopefully with social media, which we didn't have before, and that's a great suggestion.
Yeah.
While you're here, though, Turning Point is another great resource in the area. So for the people listening, can you just briefly tell them what that's about?
So Turning Point is a peer-to-peer recovery center that offers support weekly. There's daily support groups, both all pathways, which it doesn't follow any particular model. We also have AA meetings that meet there. We have NA meetings. We have an outdoor fire pit. There's a LGBTQ all pathways meeting. Everything is run by peers. We're funded by Bay State up in, I don't know where they're actually located, but it's Bay State Recovery Services, I think.
Quincy?
Maybe, yeah. But everything is peer-led. We do social events as well. We have every Friday night from 6 to 9, there's what we call a zero-proof pub, which is an open, basically, like, instead of going to happy hour at the bar, we have a zero-proof open activity hours where we do darts, games. We have a fire pit that goes on. We've done karaoke. So it's just a place for people, for like-minded people in recovery, wherever you are at in recovery. There's no specification of we don't define recovery. It's wherever you're at in your recovery process or your recovery journey. And we support you, with our meetings, our social events. And we also provide resources to Riverside. They have a navigators program for people that are just starting out that helps them in their recovery journey. We've worked with Resilience and Sharon. We have a program with Orange Theory Fitness where you can sign up for membership at Orange Theory and participate in the workout programs. We are grant funded, so all of our events and meetings are free of charge to members and non-members. The only requirement is that you are supporting people in their recovery journey. You can also be an ally. You can be a family member. You can be a person in recovery. It's a great resource. They're open Monday through Saturday. The support groups are great. The events are great, and it's a nice local resource to have.
Thank you. Thank you very much.
And I too would second that, and I would like to thank Turning Point for their help in this process. Sunshine Scotty.
Yeah, I love Sunshine
he
Scotty.
was, he helped with this process and for me to get this information out. I thank him, and it's a wonderful program you guys have over there.
Well, thank you for your time.
Thank you.
Thank you very much for what you do as well.
Do we have any
Musical
any other comments from the room? No? Okay. Justin, thank you so much for your help in analyzing this data. It's a great support for us and the town. We're assuming that we have access to this to make it public to people moving forward.
Absolutely. Yep.
You'll be able to share it with us. Thank you.
Thank you so much.
Have a good night.
Yep.
Thank you.
Oh, we have another question.
Oh, we have
So
a,
how would we have access to that data, that information?
so we will post this presentation on our website under the health department's site.
Can we also have you want citations as well? You think those can be provided? You already have them? Okay.
Yeah, I mean, there's some in the presentation, and so those links are live.
Yes.
Okay. Yeah, thank you. Yeah, so it'll be up in the next few weeks, soon.
Yeah, we can work on that. And then I just I did have a question from Gilly's house regarding how much money the town has. So right now, because of the situation we've been in, we haven't spent the money yet. So currently we have $246,839.83. So that's a couple years worth of money, that we can use starting now. So this is really the kickoff of being able to use those funds, and this is why we had the meeting to see what the community, if they had input, and the board's input on how to use these funds.
Do you think now, with this being out on Foxborough Cable Access, and maybe those who have not, I mean, the input is closed at this point, or we're still accepting? Would we still be open to accepting more? Perhaps not, maybe not in the same questionnaire. I just like throwing wrenches and things. Sorry, Matt, I'm just curious.
Still, as I said before, willing to keep the survey open and change it in any way, and to keep getting the feedback. Ultimately, I think, the decision is going to be on how these funds are made will come to the town manager, and they will have to, disperse the funds. But, through this survey and through this meeting, I'm trying to get those results on where we want the money to be spent and be able to give that to the town and the community, and spend it in a way that they approve of.
I like the idea of requesting people to ask us for money for different services, at least for part of the money. And so I really, and to see why they need the money. So I like that idea a lot.
I was going to say, for anyone watching, our emails, our phone numbers are online. So if you have more feedback, like I said, this is only 96 out of 8,000 plus residents in this town. Any feedback, send us an email, give us a call. We're always open to grow in this space. Yeah, thank you. Anyone who spoke today, if you could just please sign in for us. You don't have to stay. You are welcomed to stay for the rest of our meeting, but you can leave at any time, or you can stay as long as you want.
Yeah.
And thank you for your
We
input.
often like when people stay, but nobody ever.
Thank you.
Thank you.
I know, I'm just kidding. You can go. Thank you very much. Again, everyone who came from the support community, thank you so much for what you do.
I'll see you tomorrow.
Okay. All right, moving along. We are going to introduce our newest member.
Before we do that,
Sure.
so what should our next steps be for this?
Yeah.
Well, sorry, can you repeat that?
What should our next steps be for this?
So our steps is just making recommendations on how to use the funds. If there's a specific program, a specific dollar amounts, percentages, any recommendations that you want to give,
Or requesting,
or or request. I mean,
or asking for requests?
Yep.
Or so could we think about that and then put that on our next agenda and then make the,
Yeah.
I'd like us to start
okay.
having programs and
Absolutely.
using the money.
So I will say we are having a meeting tomorrow with internal stakeholders, and I will make that, clear at that meeting, and just
External stakeholders, meaning town manager.
town manager, police, fire,
Okay.
yeah.
Thank you.
Okay.
Thank you.
But they haven't narrowed down any programs yet they're thinking of, or you will know more tomorrow?
I'll know,
I don't why I
yeah.
asked that.
Yeah.
Predict the future. Come on, man.
Yeah.
I keep drinking on camera. This is great. It's
all
water,
right.
everybody. It's water.
Okay, so we're going to move forward with our introduction of our newest member of the Health Department. Dayana, if you would like to come up, introduce yourself, tell us what you're doing.
So excited that you're part of us
Yes.
now. So excited.
Welcome. Yes, Revere.
All right. Hi, everyone. My name is Dayana. I'm the community health nurse for the Bristol.
Just lean it. You don't have to speak right into it. Just point
Okay.
it toward. There you
I'll
go.
start all over.
Thanks.
My name is Dayana. I'm the community health nurse serving the surrounding town in the Bristol, Norfolk County, such as Foxborough, Easton, Norton. Oh, like this got brain quiz.
Plainville, Sharon.
Plainville, Sharon, Plainville. I did say Foxborough, Easton, Mansfield, Norton, Plainville, and Sharon.
Mansfield?
There's a lot to cover. She said it.
6 towns in total. My role involves educating the community, basically preventing care, supporting seniors, attending COA meetings, going to public safety buildings, public safety, working close with Tom, Kevin. He's awesome. He's been teaching me a lot. Also working closely in Foxborough for now. Basically also working within Norton, Mansfield. Some towns are still, I'm waiting to hear back from their feedback, but overall it's been a wonderful experience. Only been in this position for 1 month, so it's a growing position, slowly but surely.
And can you tell the community your background?
I've been a nurse for 5 years. I graduated from Labouré with my BSN. Before that, I have a bachelor's in kinesiology. What else? Yes, my background. I have. I used to be in the hospital setting. I used to work for Good Sam Medical Center. I used to be a cardiac nurse. Before that, I used to work for New England Sinai, which is closed now, in the LTAC. So I have a lot of experience with that. Overall, just taking care of people, assisting, educating people on the need and what they need at the current moment.
Great. Well, we're really glad to have you.
Thank you.
We like her.
So, I thank you, Dayana, for coming tonight. And this is like great for at least the community to know that, we have another nurse in the community to help out. If anyone out there is looking for nursing services, feel free, give us a call and ask and talk to Dayana to see if, she may be able to help. But one part, she's on Maven, so she's looking at our communicable diseases, trying to do surveillance. Also, part of her job will be to isolate and to quarantine if that comes up. So, I don't know if this board wants to do an appointment or not, because that is enforcing the state law. So
I think that would be a great idea.
to be mindful of that, because it does come, and we're trying to get Dayana and the other communities to do the same thing, requesting Maven access and access to the MIIS to be able to give vaccines and other things. So we're moving along.
So can then I make a motion to appoint her as an agent to the board? Is that what you're asking for?
Yeah, I guess. Yeah. To be able to enforce 105 CMR 300, which is
An
communicable
agent,
diseases.
Which is as an agent to the board.
Yeah.
That's my motion.
Do we have that in the motion? Is
That
a-
would be across each community would have to do this independently,
Yes,
right?
that is correct. So each of
So
the
many
communities. Yeah.
But
So-
remember who did it first and who you'll be the favorite of.
This is my home base.
And if you remember, Paul Gilpin, our food inspector, was in front of you for a meet and greet. So Cliff, our housing inspector, same exact thing here. She's a nurse. She's helping us out in the community. They have the same but different roles, but they still have the same powers that she would need to be able to enforce in certain situations.
So Betsy, that's my motion.
That's the motion. Can we?
I'm sorry, I didn't hear it. It was the same motion from before?
Yes.
It modified,
With
okay, I
the-
seconded it.
Okay. And then discussion, we discussed.
Any discussion from, no?
Any comments? Are you okay with that?
Okay.
Okay. How do we vote?
Aye.
Aye.
Thank you.
No problem. How are you finding, are you able to juggle the time and the different towns, or is it not overwhelming?
It's not overwhelming. It's more exciting to know how each town is different, but yet patient or clientele are very similar. Some cases are sadder than others, but at the same time, the overall idea is to educate, enforce, and help and assist the best way I can. So going forward, I feel as if I haven't met any hiccups yet. Although I have done outreaches to get patients starting back on the medication, trying to coordinate them to reinstate their doctor's visits, so trying to get them back in the community in that aspect, especially if somebody, say for example, is on a blood thinner and you don't want to stop that just cold. You want to, you don't want them to have a blood clot. So just more so educating them the best way they can.
Are you, I know in Foxborough we have Tom, and he's obviously a great resource for you. Do you feel like that's enough support, or do you get similar support in some of the other towns?
So in Sharon, we have Leandra. She's awesome. She's also a nurse.
Okay.
So far, Mansfield does not have a nurse, and Norton does not have a nurse. So I've been trying to coordinate certain, like what the town needs. So they've been telling me what they need. So, and then trying to facilitate like that, like coordinating with the COA and getting their resource and helping me out the best way they can. So it's a process.
Okay.
And Dayana, will you become a member of the Massachusetts Public Health?
I have.
Awesome.
I have.
And that also is a good resource for you, because then you could talk to other nurses when something happens.
Exactly.
Exactly.
Clarification question. Maven, I thought once you have access to it, you have access to it. You have to apply for access for each town?
Correct.
Each person, right?
Each
town.
person has to apply for each town, or you need to get permission in order to see each town. To be honest, we don't like to give out too many because it's personal information.
Yeah.
I believe I'll probably come off of the Maven, and Dayana can have my access, because we need two individuals on Maven at all time. So we have Tom Kenvin, and now we have Dayana, which is absolutely perfect.
Okay. Okay. Yeah, sure. Mike. Sorry.
I was just going to say, one thing with doing inspections and camp inspections, she's been super helpful because she comes and does checks the medical records. She'll check for things like expiration dates on inhalers, things like that, which I wasn't like, oh, I should probably be looking at that. I wasn't thinking of expiration dates. So she's been very helpful for us with camp inspections.
And who
it's
are
been
you?
awesome. Oh, my name is Megan. I'm the health inspector here.
Thank you.
Yeah. Thank you.
All right. Well, thank you. Thank you for
Thank
coming
you.
in.
Thank you.
Thank you.
Oh, sorry. I'm not supposed
Can we move straight into updates?
So I have a lot of updates for you. I'll try to move through them. 7 Revere Drive, there was a request to have the Attorney General's office, the Abandoned Housing Initiative involved. As if you can see in your packet, I was able to go there with them to inspect the property. In addition, I was able to speak to Mr. Josh Carton, I believe, who's a friend of the homeowner, regarding the situation, and he's working to help resolve the issues, him and the owner, just kind of as a sounding board and for help. So I did reach out to him.
Is that the gentleman that came in?
I don't think it is. He's new.
Okay.
But I did ask him for an update. They are working on pulling a permit to fix the building and to do the work there, as well as, according to him, I haven't been able to verify this, but the pool is now, it's been drained.
Yeah, thank you.
So, like I said, I haven't verified it. So right now, there are still active violations. The Attorney General's office is going to send out a notice. They call it a demand letter, basically asking for the corrections to be made. And that will be, something that we'll follow up on in the future if things aren't corrected. So that's kind of where that one sits right now.
Okay.
28 Oak Street was, it's been a long standing, it was initially part of the same program, but a lot of work had been done there, so the violations had been corrected, so we worked with them. Unfortunately, things started to get bad again. Broken windows, overgrown lawn, trash and garbage. So, I went back out there with the Attorney General's office to do another inspection, and that.
Are these the same person? Did you do the rounds all?
Yes.
Same person.
Yeah, it makes it easier.
making sure.
They're not coming out all the time.
I didn't
They
think
don't
so,
want
actually.
to. So we kind of reinstated that property as part of the program because it's been vacant. It was actually originally condemned and it hasn't been lived in quite some time, and it's dilapidated and needs some love. 255 South Street, so I do have an update on the receivership. We did have a court hearing recently, and the receiver's budget was approved. So they did give the owner additional 3 weeks in order to get funding to pay for some of the things that are being done to offset the cost of the receivership and to get some items out of the house if she would like. But in 3 weeks' time, the receivership will start. The contents of the house will be removed. It will be baited for rodents. And then the lawn will be maintained on a weekly basis. So, everything that we asked for should be done starting 3 weeks.
Okay.
22 School Street, no good news on this. The settlement agreement wasn't signed, so.
It was not signed.
It was not signed. So we have now switched town councils, so I have reached out to Jay Tollerman, who will be working on this case now,
Okay.
and Mr. Gomes' attorney to hopefully they'll be scheduling this soon to finalize any sort of action because there hasn't been any progress at the moment.
Can they not sign it? Like, why?
They
That's-
don't consent to it.
Okay, so the judge.
They don't consent to the timelines asking.
The judge has still not put any kind of
So
not lean, you know what I'm talking about?
no. So we've tried to work it out every possible way. We haven't wanted to push it into a contempt or, fines or anything. We just want the work to be done.
I agree, but at the
But
same time, how
how
many years?
Yeah.
multiple.
Yeah.
So, okay.
I have
We'll see what
a,
happens.
I have a question on one of the items. I don't know if it's a typo, but it's the 4th item from the bottom on the first page of Schedule A, where it reads 310 VMR.
On the,
Oh, VMR, 310 VMR 15.
Is
it probably is a typo.
Okay.
Yeah, it should be CMR.
That'd be good.
okay. I mean, I'm just for like the.
I'll just make a note of it. And
Yeah, it's. I mean,
It's
if we're
not.
gonna sign it, I don't want us to have any.
That was the one reason they didn't sign it.
Yeah, no,
right. I
it
don't
wasn't.
want there
Just
to
V.
be a reason why you can't enforce it because there was a typo.
Thank you for that.
Yeah. Otherwise, I'm fine with. Oops, sorry.
Okay.
It's unfortunate. So do we know? Do we have an idea time-wise on when we can come to an agreement with the agreement and get it signed and get a decent timeline?
I don't think an agreement is going to get signed at this point. So I think the next hearing will be it'll be a contempt hearing.
Okay.
Got it.
So
I was under the impression that's what was going to happen last time, but this, I guess, now that we have new
So
attorney,
we-
so we had new counsel, so that's why.
correct.
Okay, makes sense.
Correct.
Makes sense.
So we, as a town employee, we follow the town's attorney's advice, and Pat was amazing, and we tried to resolve the issues any way that we can. So
I answered myself. Sometimes I do that. I
yeah,
shouldn't have
no
asked.
worries. Betsy, you asked for an update on 11 Pumping Station Road. So I wanted to give that to you, just kind of cleaning out some of the old housing violations. We did check in on that. The resident from the unit that can't be lived in, so basically the illegal apartment, they have moved out, so they're no longer there.
Okay.
I contacted the owner and let them know that he can't re-rent it. I would ask this board if you have any timelines that you want me to check in or request an inspection, how,
I mean, it looks like the next one's scheduled is Wednesday? No, oh my God, that was 2023. Never mind, 2025. I looked at this
well,
wrong.
yeah, so I mean, they've moved out.
Okay.
Sorry, I'm just making sure I go back to see what we're looking at.
Just the illegal apartments, they've been moved out of there, but the house itself is still.
No, that was actually moved out too. His
Oh.
plan was to move out of his and go into that one. I haven't verified that yet,
Okay.
but, my plan was to do a request to inspect to the property again.
Okay.
But I didn't know if you wanted me to give it a certain amount of time.
How many units?
You
are
said
in this
there's
one?
nobody there right now, right?
Yeah.
Correct.
But there's multiple units,
Yeah, correct. Yep. It's a three unit
3-unit.
building.
Until nobody can move in.
I mean, I would,
Well, right now it's not
I
zoned
would think-
correctly. We know that. It's still not zoned correctly.
Nope.
So I would say an
they
inspection.
haven't corrected anything since May 24th, 2023.
Yeah, but no one is there besides him anymore. Those residents have moved. that's
I
fine.
mean, I don't know, 60 days, does that seem reasonable?
I mean, it doesn't, yeah, that's fine. I'll give it another 60 days, give a request to inspect and go out there to make sure that it's still vacant.
Yeah, the most important thing is that it's vacant.
Yeah,
Yeah.
absolutely.
We don't want anybody coming in come September. Right, I think this will get us to September.
Mhm.
Yeah.
And then 12 Winter Street, I want just to bring that to your attention and get the board's feeling regarding it. It was a septic system that I found out a while ago that wasn't in compliance. So I sent the owner a notice asking them to have it inspected. It took some time. We got it inspected. It's since failed. I gave them 2 years to fix it. It's been 2 years now, and it hasn't been done. So just wondering, what the board's opinion on how to move forward in cases like this.
Yeah, I mean, it looks like it started in 2021, but you gave them the 2 years from June 10th?
Correct. Yeah, so that's pursuant to Title V. Once you have a failure, you have 2 years to come into compliance.
My opinion is give him another letter.
Yep.
Give him 10 days to give you a plan. If that doesn't happen, court.
Okay.
10
And then-
business days? Yeah.
Yep.
Because they're actively living there, they're
Yep.
not
Because
planning on
it's-
selling it anytime soon.
Not good for the environment.
Yeah, so, you had 2 years.
Are there any neighbor claims or anything, or they're just?
Doesn't matter, it's
So-
not good for the
No,
environment.
it
I
isn't.
know that, I'm
But
just wondering.
Previously, there
Curious.
was, and then there was a system that was going to be installed, and we had the application on file, and then it was never actually installed. So it was an expired application that I found in the file, which in turn had me send the violation notice to the owner. But yep, 10
The,
days.
This non-criminal fee, is that a one-time fee? Is that a reoccurring?
That was my
fee?
question. I think it's one time.
Is it one time?
So each violation, is every single day it occurs. It can be reoccurring. It's really up to
Oh,
the
So this could have been
enforcement
each
agent.
month. So
Could be.
It could be a $2,400 fine if we want to do that.
That $100 times the 24 months since the inspection and
If I-
notice?
If I brought it to court, yes.
I'd
plus
rather they
any,
spend it towards fixing the actual,
Exactly.
but if not,
I mean, but those are the options.
Yeah.
You know, you continue to pay
I
a
get
fee of
you.
$100 a month until whenever you decide to sell the property.
But if he's not fixing the system, he's not going to be paying the fine.
Right,
yeah,
right.
Yeah.
Put it
Yeah,
towards
so, I mean-
fixing it.
Yeah, let's fix it.
Okay.
And if we have to go to court, we go to court.
And then lastly, I just wanted to let the board know, and so they were aware about Foxborough Mandarin. That's why Megan is here today with us. Basically, in Foxborough Mandarin, Megan inspected, and as a result, on June 11th, the health department issued a violation notice due to concerns that they weren't following their HACCP plan. So we required them to have a consultant for 6 visits in order to come into compliance with that, because, you know, we do issue a variance for them in order to be able to do certain procedures to keep the public safe, and, you know, during inspections, they couldn't do the certain actions that they were supposed to. So they have been compliant, and they did submit one consultant report to us. We haven't received any additional, but I think there was one this afternoon. But Megan's here if you want details regarding
I
it.
would love details.
Megan, please come up and
So
Thanks,
the
Megan.
consultants completed 6.
We requested 6. Today was the second.
Okay.
Okay.
Yeah. They hired, his name is Alfred. I believe it's Alsco Foods, or either ALSCO Foods out of Plymouth, Mass.
Okay.
The owners, Vicky and Faye, have been super cooperative and receptive to it. But we did suspend the sushi HACCP just until like, the interim of the training. Just over the course of like the 3 inspections, it didn't seem like proper training and proper knowledge of how to do it was right. So I feel like they just needed training in order to bring that back in. And then once they did hire the first consultant, after that first day, we allowed them to operate again because they did get the training in. They're continuing their training.
So I remember when they came in for the HACCP to expand their menu, that there was somebody on staff for that. I guess that person got removed or left, or must be.
Yeah.
Because I do recall we did go over that.
So we did.
No, I mean, they did have an individual there that showed that they could do it originally in the beginning, but again, as time went on, I don't know if that person left, people change, you know, the knowledge got less and less.
Oh, here it is, Alsco.
This form, is it new? The inspection form?
Which one?
Permanized.
The food inspection report?
Yes, so there's one that was permitized, and then there's one that you can like go into permitized and you can assign now an inspection like on
Got
my,
it.
or I can do like a, I go in and if it's not assigned, I just can create it. But that's what it looks like from,
It's so detailed.
isn't it nice?
Great.
It's helpful.
I mean, it's nice, but
I feel like it's helpful for the,
I'm used to this one.
yeah, that's the paper one.
Yeah.
Yep, that was scanned in, yeah. I believe that's what the consultant is using.
Yeah, it is.
We also did have them install a hand sink.
Good.
They hired pest control. They attached a self-closing apparatus for the bathroom door. They're doing a lot of things that we did ask them to do. Oh, they had a big hole in the ceiling that they had to fix in their dry storage that Chief Laracy actually went and inspected for them. They fixed that. So they've been doing everything that we've asked of them, which is great. I just feel like they need to be trained.
Do you have enough people who are serve safe?
Yes, they do.
And manager trained and stuff like that? And
Yeah,
those
because my
people on
first
charge?
initial inspection was with Eileen Hicks. She works for Burger Foods, and she went with me. My first time it was May 6th, I believe, was the first one. And then, so there were about like 15 to 16 violations, and 11 of them were related to foodborne illness factors. So that's where we kept going back.
Got it. Well, thank you for
welcome.
this very thorough.
You're just going to keep an eye on them for a while.
Yes,
Yeah.
and they've been in constant communication, like they email right back, and so like they are willing and eager to learn and be trained, I hope.
So the 6 inspections, is it every week, every other week?
So they're coordinating it over the course of 4 months. They do have to extend it a little past to do with management scheduling. Alfred reached out to me and he was like, when would you like this done by? Is it okay if there's some, I thought that was my phone. If there is, it moves past the 4 months just so we can get everyone in, because we wanted the whole staff, as per their HACCP variance plan that they submitted and we approved, it said that all management and all staff working with the sushi would have knowledge. So because that wasn't presented to us, that's what we wanted, was everyone who doing, and management. So in order to have them all there, they had to extend it a little bit past the 4 months.
Okay.
Yeah.
I mean, the HACCP was one part. Some of the rest of this was just basic things around like the food.
Cross-contamination
Yeah,
kind of thing. Yeah,
cross-contamination
basically
stuff.
like best practice. Is that
Yeah.
how we say it for the
That's what they've
restaurant?
been working on
Yeah,
right
that's
now,
what,
things they
yeah.
can do.
Yes,
Okay.
yes. So hopefully it works.
Cool.
Thank you.
Great.
Thanks,
Thank
Liz.
you.
Thank you.
All right. Are we making good time?
Yeah.
Yeah. This one's you.
So I would wanted to inform the board and kind of an exciting opportunity that came our way. We are going to have a visit by the CDC, and it's a good visit. Basically, they give a lot of money to the state of Massachusetts for funds. They have a public health infrastructure grant that they give to the state, and part of those monies have to go to local communities for public health, which we receive funds through our Bristol Norfolk Public Health Partners Collaborative and our shared services arrangement. So those funds are funneled to us through our grant that we have, the Public Health Excellence Grant. We have been part of the Public Health Excellence Grant since its inception, and we're pretty far along. We have multiple employees, and we're doing a good job. So the CDC is going to come by just to see how this money has been able to change our infrastructure here in the town of Foxborough. So they'll be on site. We're going to have some people from DPH, from MHOA. I was planning a small presentation on regarding what we do with the funds and how we use them and how they've grown our public health infrastructure and within our regional area. So I wanted to invite the board. They will be here on July 31st. It's a Wednesday. I don't have exact times yet. I believe it's going to be around 2. But we're going to have something here in the gala room and small presentation, and just wanted to invite you if you wanted to come.
Thank you. Yeah,
Thank you.
Send an invite.
I think it's a great honor, and it really has to do with your leadership in the health department, so
Thank you.
congratulations.
And that's all I have.
All right. And then we can just go to minutes, and everyone can go home for their naps.
Yeah, this was much faster than I anticipated it being.
I mean, the presentation we had was pretty thorough, and that was a great discussion.
Yeah.
Like the first, hour. So that was good. The minutes look fine to me.
I looked at them quickly. I'm just going one more time. Sorry. But just trying to. Okay. I would like to make a motion to approve the minutes as written on the date of June 10th, 2024.
I'll second that motion.
Give me a second. Question. Because we did the reorg, that doesn't go into effect until after we approve these minutes?
I don't think so.
It would be effective the day of.
I believe they're effective the day of.
Yeah.
Because you're vice chair now?
I guess so.
You're a clerk?
Yes, I am.
So now you get to sign things. This is the funnest part.
Ah, got it. So then, at the start of the meeting, that's how
Yep.
we came in.
At the
And
end of the
then
meeting.
today's minutes
That's why her name's.
would have the new assignment.
Correct.
Yep.
Got it. That was my only thing.
Yeah, that's why
Alright.
Robin's name's there, not mine.
Yep.
Good point, though. Good to be thorough.
Yep, that's all I got. How do we vote? Aye.
Aye.
Great.
Motion to adjourn?
Yeah,
Second?
great. How do we just,
Great.
how do we vote? Aye.
Aye.
Great.